Hi, I'm Dr. Farah Kamangar, and welcome to the Future of Dermatology podcast. We're here to talk about the real science behind skin, the medical breakthroughs, the cosmetic innovations, and everything in between.
Hello, we are back. Today we're joined by Mitch Hansen, which everyone knows very well. He is on the board of SF Derm. He's a fourth-year medical student going into dermatology, actively interviewing right now. So glad to have Mitch back, and he's going to tell us a little bit about all the cool things he's doing with that. But today what we're talking about specifically is art in dermatology. So every year for our big annual meeting, we have a theme. The previous year, before this past year, it was actually cinema and dermatology. And we talked about just what an influence, cinema and images have as far as what society thinks about dermatology, things like acne scars being villainized and those topics. This year, our topic was art in dermatology, which is huge. I mean, dermatology, everything is visual. I mean, the first thing we do is we teach our medical students how to describe morphology, which to me couldn't be any more, related to look at this art piece and explain it to me. So it's so visual, but I'll let Mitch get into it because this is a special just interest of his. And the other thing we're going to talk about, of course, is art and dermatology, all the amazing things that he's doing, but also how in the middle of medical school and doing all of these things, he took the time to develop the special interest of his, which I hope all physicians at all stages of life can do, because you really need to kind of cultivate these other parts of our brains that's not part of the mainstream. But we'll chat about why maybe art should be part of our mainstream education. So Mitch, thank you so much for joining. Thanks for coming back.
Thank you, Farah. It's always an honor to be a part of anything that you're doing. Even going to Napa for my first time for SF Derm. Such a wonderful community. It seems like everyone is super involved. Glad to see all the schools represented and all the great conversations that you're willing to cultivate, and even some fun. I think it was that little debate between Dr. Bhutani and
that was the best. Dr. Bhutani and Dr. Ku's debate every year. That's a famous event that goes down. But this year, it was great. They really threw it down. It was the best.
I know. And she even had the AI photo of her basically looking like a gladiator conquering. So
yeah, back to art. The most fun parts of that talk and every other talk too. The pieces where, everyone kind of zones out a little bit as people are kind of talking on slides. And then you put up some sort of art and you're back. You're back
in. Yeah.
That was really cool art. I was wondering if we could show it somehow, but it was literally it was AI generated, and it's like Dr. Ku defeated, and there's Tina and this Dr. Bhutani's gladiator outfit, hovering over him. That was amazing art. We should almost sell that somewhere.
Yeah, I know.
And then the other pieces of art that I love that in other talks was Dr. Frieden had a talk about, and I'm probably butchering the name of the talk, but it was basically, she's a pediatric dermatologist. So she talked about how facial congenital malformations lead to basically these down the stream effects. And one of the things she showed were facial malformations, and if they're on different segments of the face, how those children can end up having behavioral changes, even some of them even similar to attention issues and things that you see from maybe kids on the spectrum or autism spectrum, where they have visual field changes. But because if a child has a congenital malformation, if other people are not looking in their eyes as much because they want to avoid the congenital malformation, they end up developing kind of similar malbehaviors as these other disorders. That was a total rant from off art, but I just love that her art in that talk about kind of showing those different malformations and where they are on the face, how it leads to completely different life and behavior.
Oh,
so that, yeah.
Yeah, no, I think that's actually a beautiful tangent, because this actually doesn't even touch into my experience or knowledge of art, but actually this touches, I'm doing a dual MPH right now. And so I actually did my MPH in Vietnam at the Vascular Anomalies Clinic. So they use laser therapy to treat kids with vascular malformations and congenital nevi that are very disfiguring. So that experience for me, I think on the tandem of art and kind of talking what you're talking about with kind of behavioral outcomes being different for those with facial malformations and facial disfigurement, is that one of the doctors there was talking about his experience actually doing, because this clinic is mainly just for pediatric populations. All the care for pediatric populations is free. They help fund the clinic by getting adult populations to be able to pay for some of their services. But one story that he was mentioning is that in visiting an orphanage in China, what he noticed is that kind of the trend was that not only, of course, just with the cultural things going on there and some of the history, it was suggestive of mainly being female populations of being in the orphanage. But what it really was dense of was facial malformations and disfigurements, which I think it just
Wow.
leads to a lot of cultural competency that I think is required in caring for that, for understanding how that is maybe uniquely looked at in their society. So I know, like, if, for example, at least, which I kind of like joke about with patients every so often when they go, what is this like really like bright red spot? And I'm like, oh, it's like a cherry angioma, and like, don't worry about it, it's perfectly benign. And actually, at least from what I've been told by some of my Chinese patients, is that it actually represents like good luck because of the color red, to where that's actually
Oh.
like seen as like very positive in their culture to have something like that. Meanwhile, we're over here like, just take it off, take it off.
Yeah, we're like,
Um,
where is our vascular laser? Get this off.
so yeah, no, it's very interesting when I kind of on the tandem more of when you see how, I guess, something in our culture, it might be like very well understood or received, and it might mean something totally different in another culture and lead to those downstream effects as you're talking about. No, that was a very good point.
Yeah, and actually I think like art is another way too, is you get into the culture of something. And the dermatology has its own culture. I mean, if you go to any dermatology conference, we are like a different breed of people. We like live and breathe dermatology, and it's just so interwoven. But tell us a little bit more about what we actually did. So you were tasked with basically not tasked. This is your idea that you had done at the AAD, but we said, could you kind of replicate this at SF Derm? And it was amazing. So tell us a little bit about how you kind of brought that art alive for the conference.
Yeah, yeah. Thank you, Vera. Well, like before I even talk about it, thank you for even giving me the platform to be able to do it in like a wider audience and being able to engage with the SF Derm community like that. It's a very big honor to do so. But yeah, so from AAD, for those that don't know, this was kind of started at the AAD LGBTQ sexual gender minority expert resource group. Very long name for an advocacy group affiliated with AAD. We did our first art show there at the AAD conference, where we basically polled and just kind of sent out a survey to our members saying, do you want to submit an art piece? Do you want to have something represented here? For a few select people, we'll have you'd maybe do a presentation of what it means to you and what you are hoping to bring to medicine with that understanding of art. And we had a few pieces showcased. With how positive the results were from that event, just for seeing all of the conversations that I don't think would have naturally occurred without some of that art being a facilitator there, and just seeing how positive of an outcome it was for the very end of the meeting, where you do kind of get to take that deep breath and go, okay, I'm done with this. I'm done with the screen. I'm done with the done with the words and the numbers. I get to just take a second, breathe, and I get to like just see something and appreciate it for what it is. So bringing that to SF Derm, what I wanted to do is expand a little bit on that. So not only did we ask students from across the country to submit pieces, we actually had, I think, over 20 pieces. We had 3 countries represented and over in 2 continents, which is crazy that you pull in that wide of an audience. We had multiple art forms demonstrated. I think painting and drawing happened to be the most predominant ones, but we definitely had some multimedia pieces. And we had some photography. We had some like clay making and like geode structures. But not only that, but what we also did is that I wanted to expand on how this is really pertinent to SF. So there was actually a researcher and physician at UCSF, Herbert Castillo. He does amazing work. He's one of the friends with one of my mentors there. And he actually did an art project in SF where basically a lot of the art research that has been done has mainly been done in the context like museums. So a lot of museums today, it's very Eurocentric related art. So it's from like kind of one standpoint versus being able to understand art that is from a lot of the like patient populations that we serve. So what he did is that he did a very cool art project where he identified kind of cultural enclaves throughout SF and brought residents there almost on like a little field trip day where they get to have, I think, a little bit of bites, a little food, and then also get to look at the art and kind of talk about, how they think about this might be relevant to some of the patients that they serve. And so I wanted to do that. So what we did is that I found like different murals throughout SF and kind of wrote up like some of their cultural and like historical significance. And we kind of had like a little cultural competency corner where you could kind of see all the different murals throughout SF. And I only touched like 10. There's well over hundreds. But yeah, a lot of that actually dates back to the I think Works Progress Administration with Roosevelt in the 1930s and 1940s, and kind of beautifying SF and making it a more beautiful place. Um, so we brought that. We had student pieces, and I think there was one more. Oh, and then we kind of did a fundraiser, which you had the amazing idea of doing, where we actually sold some of these pieces for students that are willing to do so, and we ended up raising around like $2,000 with matching funds from SF Derm Society to donate to Camp Wonder. So overall, it was beneficial, I feel like, for the participants, the students, and also Camp Wonder. So it was overall like an amazing event from what it felt like.
Yeah, it really was amazing. And Camp Wonder, I think most people know what it is, but it's a camp for children with lots of skin conditions where they couldn't go to regular camp, basically. So this is a special camp that happens where they have physicians on site and volunteers. They can just form a community. So it was really cool to actually be able to contribute to that, as well as it was like a side piece almost in the beginning, but then in the end we were like, oh, that was a very cool part of it that was able to come together. And it was incredible, like you mentioned, the reach. So the amount of people who submitted cases from like around the world, which just also speaks to the community that we, like you mentioned, that we built. It's just actually just such an amazing thing to see. I mean, people were like FedExing these things in. There was a point where I had like all these like tubes of posters and things like, all around, but it was just so incredible to see how many people just like resonated with this. And the art was incredible. It was so good. The one piece I would say is we've done all this community building and education, but the one like muscle I feel like I could exercise is the fundraising muscle. I almost feel like next year or another year, if we do it, we like lead into that more, because I do think in the end that actually added so much value to the project. And then the kind of field trip type of go around San Francisco with the murals, it's just giving me the idea. Next year our meeting will be in San Francisco. We should almost do a half a day. We should go around and do
Yeah.
drinks and
Little
bites and look at this
little
art.
tour bus or like a
Little
sprinter van or something
tour
like
of,
that.
yeah, just get one of the cable cars on wheels and go around the city. And then when you mentioned, like even the cherry angioma correlation with a different culture looking at it so much differently than we do, I would just love at some point, I mean, maybe you'll be the person to do this, for someone to go around and do like a comprehensive overview of like how cultures see all these conditions that we treat, because obviously we're not the only people seeing vitiligo, we're not the only people seeing seborrheic keratosis, and I bet there's just all sorts of cool things that people are, because it's so visual, so everyone's going to have an opinion. And then different cultures have different languages and just different words to describe a certain thing, which gives it more meaning as well. So I feel like it's a whole dimension of what we do. Like you mentioned, we know dermatology from a, English speaking framework that we've been taught it, but there's this whole other world that I feel like, we could slowly kind of unravel. And then you could teach us all these things over time.
Well, I'm hoping to teach. I'm hoping to teach something one day as I kind of
Yeah.
find my niche. But yeah, no, I'm definitely interested of how it intersects. And maybe probably when you ask me later on, like how does this apply to the future, I probably will talk about maybe like my interest
Yeah.
with it with like psychocutaneous dermatology. But no, like leaning into the fundraising part. Actually, like research suggests that like when people feel like personally connected and have like stories embedded in like what's going on with art, when we're thinking about this fundraising component, it also encourages people to donate. And especially when you are talking about rather than just, an altruistic donation, if someone's getting something in exchange, they actually do feel more motivated to donate as well. So it's almost like they get to kind of attach some of that value of the experience of donating, like what they're kind of donating to that art piece as well. So it's almost like dual-sided in itself,
Absolutely,
which is
because they
really
got
cool.
the art to go home with. And this
Yeah.
is actually something that a lot of the doctors brought up as they were kind of going around and have these conversations. They were like chatting together. They're like, what art do you have in your office? And I'm like, that's an
Oh.
interesting point, because it's like, it's not a thing you think about, but it does say a lot about you. When patients come into your office, let's say they're coming in for the
Hmm.
first time, they don't really know you. The pieces you choose, of course, the decor and all of that, but just the art pieces you choose do kind of say a lot about what vibe you're putting out there.
Oh yeah.
So like what a cool thing for them to be able to like maybe put one of these in. And a lot of them said they're going to put these art pieces in their like offices and, like
Oh,
around,
good.
patient facing areas. I can imagine if they like also, because you wrote up really nice descriptions too. If they put it with that description, it just adds this whole other element in your clinic space as well. So
Yeah, I feel like it's on. Thank you for saying that too. That I feel like that's such a good way. And I was actually one of the kind of the first things I was thinking about. I was like, oh, this is like a way for like providers to get like art in their offices because like I feel like having like art or like whatever you have up on the walls, while it sounds so I guess like rudimentary, I feel like it actually is such a very easy way, an unsaid way to show support and just like inclusion of like the patients that you're inviting into like your establishment. So like, if you're having a lot of like skin to color based pieces and you're having ones that show like skin disease, but also maybe in a beautiful way, you're kind of almost setting like an undertone for like your skin disease might be a part of you, but you are a whole person in general. And that is what I'm like looking at today. I think I have also kind of did an article for Dermatology on like modernizing sexual health history. And I did a little podcast episode on it for AMA. But like when they were asking, how do you make your office space more inclusive? It starts from like the very second that patient walks in the room. It starts with the receptionist, the interactions they have with other patients in the room, how they're greeted by the nurse, how you greet them as well, and then literally all the way to checkout. So if we can like make that experience already more warm and welcoming from the start, I think it just sets things off in a much better tone.
Yeah, 100%. And I think like because the basic medical clinics have looked the same for so long. So
Mm-hmm.
this is such a valuable tool that doctors should lean in on. Like the art is such a huge piece. We've also done studies with music. I mean, we're talking about like a different kind of art from there, but
Uh-huh.
having the right kind of music, or we have like I remember at UC Davis we did studies with our Mohs patients of if you play music, their anxiety levels decreased so much during procedure. They had like better outcomes and like just it was good all around. So these are parts we're so busy with practice management and all the pieces of what we do that we kind of take these parts for granted, but it literally could be 90% of the visit for the patient from the other end. So it's like, you can't ignore these things. One, in education, it's huge. And there's actually there are studies about how it enhances education. I forget the specific subtype, but there were some studies out of Stanford. They used specific kind of art in the resident training, and it almost like improved. We'd have to do a dig on this and
Well,
find it, but it had like a specific, or maybe you do know this literature.
Well, I think it's I was just like glancing at it earlier, just like prepping and
Yeah.
everything, and make sure I'm on my toes. But it was one study I think that was completed at Stanford between 2018 and 2019, where they kind of saw a multi-purpose for art and student and resident training, not only for wellness but also cultural competency, a ability to demonstrate empathy to patients, communicate as a team, and also to patients. Such a multifaceted benefit to it, and I think it's also a really good way of kind of merging in maybe some subjective conversation and interpretation for maybe curriculum that you just can't make well constructed. Just having some of those organic conversations I feel like might be so integral for some of these residents before they go on to be an attending. Because it's almost like, as you said, with like, how critical this could be for physicians to use in their practice. I feel like when you leave a physician's office, you might not remember every word because they'll be giving you, 3 or 4 recommendations, explaining a condition, saying side effects, and then being, okay, on your way, very nice meeting you. I'll see you later. But you will remember the feeling you have from interacting with them. So it's almost that same of like,
Yeah.
you might not remember exactly what the art piece was, but you remember, hey, I remember having a really good conversation about like understanding their cultural take on this and how it impacted them. That's something maybe important for me to consider with like how I'm explaining a treatment to a patient. Do they see it differently than maybe in my culture?
Yeah, like 100%. And it's, we kind of talk about the clinic encounter, and then and do they do the step 3 still where they do have you do like the fake patient encounter? Is that still a thing that was like part of
Oh
step 3
Lord,
of like a
I don't
clinical?
know. I take it next year.
Hopefully that's gone. But
Yeah.
it's like, that was like our example of like, this is the interaction. You walk in, you wash hands, which you should wash hands. I mean,
Oh
I
yeah.
think, the germ theory has been proven. So we'll go with that. But you wash hands and then you say yes. And, so you're kind of trained in this kind of model. But really, what if you walk in and there's pleasant music? The walls look nice with art. There's maybe even a non-allergenic, hypoallergenic fragrance in the room. I mean, these are the things that probably add so much more than like what our brains take as, well, if you do these non-verbal things, then this will communicate to the patient trust. And Oh, I just feel like we're leaving so much on the table. I think the commercial world knows this really well. Like you see these like cool little coffee shops popping up and like, why does that coffee shop do better than the one next to it? They're both selling coffee, right? But they have the decor down and the experience and all of that. So I definitely think it's like something we're missing out on, but we don't have as much time either. But I think, it's so important that we have people like you reminding us and bringing it to the forefront. And then just letting, the students express themselves and everyone who kind of sent in art. It was just like beautiful. So,
Yeah.
but thank you for sharing everything else that you've been doing. And we always end with the future. What are you excited about in this field? Because you're doing so much of it, and so much of it, I think you've created on your own, and it's just worked out so well. What's the next step in this for you?
So I think it's very multi-tiered for me. Oh, also I have a kitten on the screen. Sorry, that was
Oh, hello. And pets.
I
Maybe
know.
also have pets in the office. Hypoallergenic pets.
But yeah, so when I see it for me, I feel like it's very multi-tiered. And I'm very excited if I think about like my next steps in dermatology of like, I think not only for mentorship, I think one of the original reasons I wanted to bring it into the derm world is because I feel like derm is very faculty and resident heavy. I feel like it's harder to make an impact and make it like feel part of the conversation as a student, just because we want to protect this field for people that are really going to solve health deficits and making sure like we're filling it with people that really care about our patients. So I think allowing students to feel like they're a part of something and like contribute their voice in some way, especially through art, I feel like that was a very valuable tool for me. So I would like to see it as a tool maybe for mentorship. I would like to see it as a tool maybe for psychocutaneous dermatology. So especially like for kids, I know that there's like art therapy, especially for kids, and that's been pretty well studied. It's just, I would like to see maybe how it's maybe a vehicle for like communication for kids with like chronic skin disease. So like, can they draw out how they're feeling, or can they maybe like point towards or visualize it in another way rather than just words that might be going right over their head? Because I mean, the average reading level in America is a fourth grade reading level. So I feel like that's something we all forget, and that I kind of have to remind myself daily, like making sure I'm saying like blueprint, or I'm saying like map or instructions instead of like DNA, because a lot of patients might not even know that term, even though we assume that.
Right.
Um,
Yeah.
and then thirdly, I think also as a part of like curriculum, I think not only does it promote wellness, I think it promotes diversity, equity, and inclusion, which are still principles that are really important for dermatology, as we do see a lot of patients. And I think it's those are things that we need to preserve, especially as we continue to select people that are going to be really solving the health deficits that are continuing to propagate. I'm very excited to see how it's going to turn out and evolve in the field. I think, as you were saying, Lily, with like the Mohs surgery, whenever someone goes, "Oh no, I'm fine with any music," I'm like, "Are you sure about that?" Because it's a 60-year-old man. I'm like, I'm turning on Britney Spears if you don't care that much. And I was like, you better say like rock or country or something. So this could be better for you. You're the one in the chair, so I want to make sure it's a good experience. But it's just all super exciting, and I think mentors like you and that are like facilitating this, it means a lot to us like students that like are aspiring dermatologists. So thank you.
It's incredible what you're doing. So excited to kind of see the next steps. Next year, we're going to do the tour. Let's take this up a notch.
I would love to. I can be on a mic.
Right? Yes. On the in the track, and I completely agree with you. I think our medical students. I felt like this as a medical student, and I've kind of seen it, outside that training phase too. But medical students are the most like underutilized group of people, because what you don't realize is, in our journey of a forever journey of training, sure, it's early on, but a medical student is not an early on person. This person is in like a really highly competitive graduate school. So for any other field, that would be like the end game right there.
Yeah.
But we know now, okay, you have another 10 years after, so we're going to kind of see it as this like almost middle step, just this little medical school thing you're doing. But the medical students, and what we have to realize is they're the sharpest. Like our brains are sharper in our mid-20s, and it just goes downhill. So, especially I've seen it in like my special passion is developing technology. But of what I've seen over time, it's the medical students that are going to make the biggest change in health tech innovation, because the attendings are kind of set in their ways. I try to explain things to them, but like, no, I've just been clicking this thing this way forever. So I'm going to continue to click that. But the med students are, in these environments, watching everything and just absorbing it they're at the sharpest stage of their life. I mean, they're the ones seeing these like innovations, all of that. So as just an aside, bringing it back to that like mentorship, any tools we can give medical students, I think that's where the best of medicine is going to come out of, is like that phase of life.
Yeah,
Because
no.
afterwards you get tired and you lose a few brain cells because you don't sleep as much.
Yeah, no.
I completely agree with that.
Yeah. Yeah, I mean, even at my like last away rotation, we had like one big conversation on like everyone's feelings even towards like medical media. And there were a lot of people that are very obstinate on like, I will not do this. I don't see the purpose in this. And, me on the other side of things, I'm more so trying to be, it's almost like a fight at the table between like one sibling and the other. I'm trying to facilitate it being like, I see your view and I see your understanding. And I think it's just time for us like to rise to the occasion to see how we can adapt with some of these new tools. I mean, some of these creative outlets, as you said, like last year, like having like film and media as one and having like art as another one. If we can only try things so hard, like to reach patients and provide patient education, if we don't throw our hat into the ring and have our voice in the conversation, it's going to get lost for us. So I feel like it's just about adapting and being flexible and realizing like what are the most pertinent needs now in our system.
Yep, absolutely. I love it. Can't wait to see all the things coming up. Any other events we should do a shout out to? I know you're doing a lot with the AAD, or as they come up, you let us know and we'll post them on our. But your next kind of art events that are coming up, we'll post them on our Facebook and Instagram. And if you're not following us on SF Derm, Instagram, Facebook, all that, follow us there. Follow the podcast. Obviously, you're here already, so we'll kind of post these things. And so as they come up, let us know, because there might be more people that actually want to submit and take part of this.
Yeah, no, I think the AAD is doing their Art of Skin event in early September. I think September 9th, I think is the date of it. So they're doing that. I'm trying to see if there's any way that they want me to be involved in any capacity. We're hoping to do the same thing with AAD ERG next year at the annual conference. That's going to be, I think, in Denver. And then we're hoping to do a little bit of collaboration with Derm Times. For those that don't know, it's kind of a magazine that publishes on some research that's going on, also some more humanities things that's going on. I actually posted, they actually published me for just talking about my story leading into art and how I view it as like an outlet, and then talking about our experience with AAD ERG. So we're hoping to do something with them too. But yes, absolutely, we'll share all the new ventures coming up. And hopefully with you next year with a little art
we have to
with
do
a megaphone and a mic and a dream.
Yep, we'll do a pregame and then we could do it again at the the San Francisco AAD, because after Denver, the following year will be in San Francisco. So we'll start pregaming the big art show.
So good.
So let's go. Well, thanks again, Mitch, and great luck as you're applying right now, going through rotations. And I know that's not an easy process either, but you're just such a rock star that you're going to do
Thank
amazing.
you, Farah.
Let's go. Well, thanks again.
Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe, and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.